we're going to go over how to use the new GE Ultrasound for blocks. And you just pop it open right here. And what you're going to do is load a patient ID number. It prompts you to do all this. And then you can tab over and put in, let's put in Jane Doe. And you can either tab, or you can use the roller ball and just hit your enter button, and we'll put in her, all right, and then so you've got Jane Doe loaded in here. That's all you need, your identifiers, your MRN, your first and last name, and the date of birth, and just make sure it's all correct so that when it loads to the PACS system, it goes to the proper chart. And then you just roll her down and hit the exit button, which will bring you to the screen that you need to see for the exam. And of course, most of the time we use the linear wand for the ultrasound. When people are a little fluffier or they need to see deeper, then you can use this curvilinear one. And a good way, if you do have to switch, you don't mess with any of this stuff here. All you have to do is you'll see that there's an exam button here, and you're going to hit your exam button, and you'll see that the screen has your linear probe, this little guy, I don't know what the name is, and then your curvilinear one. So if I wanted the curvilinear, I would just roll her over here, hit enter, and you'll see that it is now kind of on this curvilinear one, so that they could use this one. I'm gonna hit exam and go back to our normal one here, and so all I'm gonna do is hit that. So it probably presets to interscaling, because that's what we do most of the time. And really all that does is a preset for the depth, because the interscaling, of course, you're not going very deep, and so this is set at 3. And if you wanted to change that, you could always hit exam and roll her down to popliteal or adductor canal or axillary or any of that, and that's under small parts. Or you can just hit nose block. But any of that can be changed just by changing the depth as well. And so say you can't remember how to get out of this screen, or any screen for that matter, always just hit the back button, and that brings you back to your previous screen. One good guide is to make sure all these are lined up. If it's found like this, it's okay, the physician can ask you to do that, but really it's going to mess up the picture. So it's just easiest to always have these lined up, and that just makes sure the picture, the image on each depth is in line, kind of thing. So you know, you put the gel on and you've covered your probe with the tegaderm. You've done the ultrasound or the block, and now what do you do? Always make sure you hit the store button, and that takes your picture. And the nice thing about this machine is that your picture will show up here, or however many pictures you take, and then you know that it's linked to your patient. If for some reason you've set it up, somebody else has used it, and you want to go back, and there's no patient here, record the name and the number, and I'll make sure it gets associated with the right chart. So let's see, so you've hit the store button, then a picture pops up here, so you're all done. So all you want to do is hit this patient button again, and it's going to bring you back to the screen. And there's often a list of names here, so maybe you've loaded, you can actually go ahead and load all of the patients for the day if you'd like, and then you just load it and keep hitting the patient button, and that'll list everybody here. So say Jane Doe comes back for an exam, all I have to do is hit her line. I'm going to resume the exam, which I would do if I'd also preloaded all my people for the day, all my patients. Resume exam and hit exit, and it'll bring us back to Jane Doe's thing. So anything you do, you know, will go back to her chart again as well. So that's always a nice button. Let's see. This, so when you're in your patient screen, go back to Jane. We're gonna resume her exam and hit the exit button to bring us back to the image screen. And say she's having an adductor canal and you just can't quite see that artery. Well, you're going to turn this. This is your depth button, and it's labeled right here, depth. And you can see it's changed the depth to 3.5 now, and now we're at 4. So the ultrasound is actually penetrating deeper, and hopefully they can see that artery now. There are limits on how deep you can go, but of course the deeper you go, the poorer the image becomes. So anyways, but the doc will often ask you to hit that button. If things seem a little fuzzy, or the screen is too bright or too dark, this is your gain button. So this makes things, you can actually see it a little bit here, it makes things lighter. Or if things are too bright and too light, then you just turn the other way, and that makes things darker, and sometimes that makes the nerve image pop out a little better when you go one way or the other. So those are really the two buttons you need to know to make the image better. Sometimes you've preloaded everything, you're ready to go, but you've been sitting around for a while. This freeze button will be green, and that's just an energy saver mode. But when you go to hand the probe to the physician, all of a sudden there's nothing on the screen. They'll say, well, what's going on? And just hit this button so that the green goes away, and that means it's enabled again and you're ready to go for your ultrasound. Let's see. The battery does not last very long on this, so always try to make sure that it's plugged in. You can use this is a newer ultrasound, so either of these wipes are great for cleaning off the probe and anything else, but always only use just a damp cloth for the screen, never any chemical for that. If you forget a few little things, I've written a cheat sheet here, and that'll help you, hopefully help you just maneuver through this as well. This reminds me that this particular ultrasound also has buttons on it so that the doctor can manipulate, they can actually take a picture with one of these buttons. And I have listed on the sheet here, there's a buttons 1, 2, 3, and 4, and they're labeled. And that button number 1 is for saving an image. Button number 2 is for auto gain, and that's that light and dark again to sharpen up the image a bit better. And then buttons 3 and 4 are to change the depth, or you know, this thing, or how deep they're penetrating, so they can see their structures better. I think that's it in a nutshell. Another button here that's sometimes helpful. Occasionally they'll ask you to turn the color on because they're trying to determine whether the structure is a nerve or a blood vessel. So it's helpful to turn this color one on, and then you can, you know, of course, see if it's red or blue according to the vessel. Sometimes the box for the color pops up and it's all this crazy color screen, and all you have to do with that is change this button, again, the auto gain button, and twirl it until it goes away, and then you just see the blood vessels or the structures. And you can also move that box around with that. So say the artery's down here, but the screen box shows up here. You just rollerball it down with this till it gets to the part that they want to see with the color. And really, that's about all that you really need to know with this ultrasound. Thank you.